What medicines do not heal, the lance will heal. What the lance will not heal, fire will heal. I'm Dr. Nathan Good, your medical director at Brio-Medical in Scottsdale, Arizona. That was a quote from the father of Western medicine, Hippocrates. What he was essentially saying was that heat, fire, is going to treat and heal what the lance, what medications cannot. Fire. That really dives in to the immune system and really dives into the core of what a treatment like hyperthermia actually does. Today I want to talk a little bit about this treatment, hyperthermia, but I want to talk about it in the context of whole body hyperthermia. There is also local hyperthermia, which we will discuss elsewhere, but here we're talking about the concept of whole body hyperthermia. So what is hyperthermia? Hyperthermia is two parts, two words brought together, raise heat. Okay, that's what the process, raise the temperature, what hyperthermia means. And here what we're doing in whole body hyperthermia is we are raising the entire core temperature of the body. And so when we look at how mainstream medicine, conventional cancer care approaches it, that is the treatment of cancer, it's really a healing crisis, a crisis of healing treatment. Again, the concept is go to war on the body, go to war on cancer. Everything else is collateral damage. And then we'll regroup and try to rebuild. When you look at wellness, it is the restoration of healing. Integration is the restoring, the renewal of that process. Nowhere in this concept of what medicine originally was, healing, wellness, is destruction a part of that process. That is a war mentality. And war only perpetuates destruction and more war. And what happens, unfortunately, in some of these conventional cancer treatments is the immune system, the ability to actually generate the heat, raise the temperature, is destroyed. And what we want to do is not destroy the body, destroy the immune system. We want to destroy the tumor. We want to heal and support the immune system. And so this concept of destruction to heal is a flawed concept. We want to heal to heal. We want to target the tumor but heal the rest of the body. And this is this crisis of healing that we see today in cancer treatment. So what we want to do by using hyperthermia is use the inborn mechanism of the immune system, of heat generation, to promote this healing process. See, the body wants to heal. No matter the age, no matter the presence of disease, the name disease, or how spread maybe cancer is, the body is going to work to heal. Now, it may not do it well. It may need a lot of pushing and support to achieve that healing, but the body's capacity to heal is always there, no matter the age. Now, a person at 92 is going to need more push to heal than somebody at 22, but the body still works to do that. And hyperthermia is really diving into the immune system to support that process. Now, when we look at the process of healing, the immune system, we want to use that immune system to tap into what it's designed to do, and that's to protect the body against all enemies, both foreign, think more infectious, and domestic, think more things like cancer. But in the concept of dis-ease, or lack of wellness, the immune system is dysfunctional. And in fact, when you look at conventional cancer care, the immune system in many ways is the target of treatment. In fact, there are very old literature descriptions of spontaneous tumor regressions, whereby, for example, a 12th century priest had an osteosarcoma, a tumor of the muscle, and developed an infection, and that cleared his tumor. And in fact, literature today recognizes that our approach to targeting the immune system, and really in many ways leading to immunosuppression, suppressing the immune system and destroying the immune system, that's why we don't see as much spontaneous tumor regressions today. It's because we're destroying the body's ability to generate an immune response, to generate heat. that can actually spontaneously regress and destroy a tumor. And in the day-to-day, where we target the immune system and hurt it, where we reduce the fever is the enemy. It's not a foe, it's actually a friend when controlled. When we have patients, when we do fever induction therapy and their fevers go up, I give them a good fist bump, because that is the immune response we want. That is the body's immune system going to war on the cancer. We want it to go to war on the cancer, not on the rest of the body. And hyperthermia allows us to do that. Now, the great thing about hyperthermia is historically it's not new. This concept of raising the heat through the immune system has been around for, it's estimated, 5,000 years, 3000 BC. And it's done so through a variety of mechanisms through this historical concept. Ancient Egypt. So a physician by the name of Imhotep actually would use poultices, which is herbs, put on a tumor site, and then they would cut through that into the tumor, and that would generate a fever response. Ancient Greeks also recognized the power of heat application with saunas and other ways. Also, Rome. Actually, there was a goddess of febris, goddess of fever, that they worshipped. Now, when you look at these ancient cultures, it was much more of a heat application than it was necessarily a fever induction. Now, as I mentioned, that cutting through the poultice into the tumor and generating a fever response there, an infection, if you will, that was not a heat application, but historically, and including Native Americans, heat application was a way that they targeted illness and disease, here particularly cancer. Moving more modern times, we moved from a heat application approach to more of a fever induction approach. And this was through a German physician by the name of Dr. Carl D.W. Busch, B-U-S-C-H, but then in America via Dr. William Coley, who is actually a surgeon. But Dr. Carl D.W. Busch, actually a German physician, actually predated William Coley's work by approximately 25 years. But Dr. William Coley gets a lot of the credit there because he developed a actually heat-killed bacteria concoction that he would inject into patients, and this induced a very, very aggressive fever induction therapy, and it became known widely as Coleys toxin. Now, what he found, and his work here was because he was unsatisfied as a surgeon in the treatment of a sarcoma in his patients, particularly there was a young woman that passed away. And by inducing fever in these patients through this heat-killed bacteria concoction called Coleys toxin and injecting into the patients, an induction of the fever through the immune response, he was able to significantly increase 5-year survival in terminal cancer patients just simply by tapping into the capacity of the immune system. Now, this fell out of favor, and then eventually now here in modern times, we are now in a more mechanical core temperature fever simulation or mimicking effect. So we went from a heat application to a fever induction to a more modern mechanical controlled heat mimicking effect. So what we're doing here is trying to regulate and control the capacity to generate a core temperature elevation, fever, but not have it irregular and out of control like what the Coleys toxin sometime did. So essentially through history, whether it be through ancient Egypt to Greek to Rome, and through the heat application fever induction to the fever mimicry mechanically, we are really just following the fire of Hippocrates through history. Hippocrates talked about the fire, and it's just following through history. It's amazing what some of these ancient scholars and physicians did with so little data, so little information. Yet today we're overwhelmed with information, yet we do so little with it. And hyperthermia is the perfect example. So let's talk about the immune system specifically as it relates to hyperthermia. Because what we're doing in hyperthermia, that is whole body, is we want to tap into that immune system storm. You know, there's a saying out there, the calm before the storm. What hyperthermia is really doing is trying to control and present and regulate the storm, the immune system storm that eventually will cause the calm. The immune system's mechanism is to defend the body. What I tell patients all the time is it'd be better to never get cancer. So the answer to cancer is never get it. But if cancer is present, the answer to cancer is the immune system. And hyperthermia really allows us to mimic that, control it, regulate it, and provide the effects of that hyperimmune stimulation that counters and specifically targets cancer and makes other therapies work better. So let's specifically talk about what hyperthermia is. We want to achieve a temperature of about 39 to 42 degrees Celsius, or essentially 102.2 to 105.8 degrees Fahrenheit. Now, this needs to be sustained at those temperatures, those peak temperatures, for about 1 to 2 hours. Now, that has to occur with sedation. If this is something where you're getting in a unit and you're there for 30 minutes, 45 minutes, and there's no measurement of core temperature, whether that be a Foley catheter or a rectal thermometer, there are some skin temperature devices that directly correlate with core temperature. If you're not following temperature, you're not undergoing full hyperthermia benefit and full immune system mimicry and inducing that fever type approach within the immune system. So it needs to be about 2 hours. Now, it typically takes 1 to 2 hours to raise that temperature. And again, proper sedation, 2 hours to sustain, and then a cooling down period. But even 39 degrees Celsius, 102.2, can actually be a powerful hyperthermic immune mimicry stimulation. So there are many different mechanisms of hyperthermia that we receive in the benefit of that 39 degrees Celsius to 42 degrees Celsius. There are 5. There are directly cytotoxic effects. There are immunomodulatory effects. It is an oxygenation therapy. It targets cancer stem cells, and it augments other conventional or integrative cancer therapies. So let's talk about each one of these. Hyperthermia directly induces cancer cell cytotoxicity. Cytotoxicity means cell death. So we want to target the tumor and not the rest of the body. If you check out the video that we talked about as it relates to hyperbaric oxygen, we talked about the uniqueness of the tissue types and their response to treatment. The same applies to hyperthermia. Research has shown that core temperature elevation, immune stimulation, will affect cancer differently than it will affect healthy tissue differently. We cannot think of one-size-fits-all approach as it relates to treatment, but also does not apply to how the different tissue types in the body receive it. We can target the tumor and preserve and not target the non-tumor tissue, the healthy tissue at the same time. It fits more with that healing strategy that we want. So here are some of the mechanisms by which hyperthermia, whole body hyperthermia, actually is directly cancer cell killing, cytotoxic to cancer cells. It induces apoptosis. This is that programmed cell death capacity that often gets turned off in cancer and that metabolic shifting. But here, the hyperthermia through heat shock proteins is actually going to trigger this destruction of cancer cells. It reduces the tumor volume. So it's going to kill the cancer cells and reduce the tumor volume, the tumor burden, the actual primary tumor. It activates the immune system, which we'll get to in a second. It attracts the immune system to it. We'll get that to a second. It reduces what's called vascular endothelial growth factor, VEGF. This is an important signal that's involved in angiogenesis that's a part of hypoxia. As I mentioned before, is a multiple force applier to the process of cancer. So it's going to basically cut the neck off, cut the supply source to the head of the tumor, and that's going to be more apt to kill it. So hyperthermia actually cuts off the process of angiogenesis that is feeding the tumor but also taking away the waste. And it's specifically that is hyperthermia turns off hypoxia-inducible factor 1 alpha signaling that comes from hypoxia that drives all of this metabolic shift, oncogenic shift, immune evasion and transformation that promote cancer invasion and spread. That's whole body hyperthermia directly targeting cancer cells. Not just broadly, but very specifically. In fact, research shows it. Now, there are many areas in the world where hyperthermia is a mainstay of therapy and a mainstay of conventional cancer care. And that needs to be something that is worldwide and universal wide, but unfortunately it's not. Whole body hyperthermia provides many, many, many benefits beyond that of local, because cancer is a systemic process. It is a systemic disease. To focus on cancer as just a localized effect without any systemic effects is really born out of scientific ignorance. And unfortunately, that's where a lot of medicine is today. Probably the biggest effects of what hyperthermia does beyond the directly cytotoxic effects is what it does for the immune system. And in part, it does this through the production of these heat shock proteins. And these heat shock proteins they're produced out of the stress of the heat. And again, we can see this effect occur differently in the tumor tissue versus the healthy tissue. And these effects will be in three broad immune types of cells. First, dendritic cells. Dendritic cells are they're macrophages, a type of macrophage that are very important in what's called antigen presentation. And these cells will destroy abnormal cells, viruses, bacteria, but also like cancer cells. And they will then say, well, I need to present this to the rest of the immune system and get the immune system involved. And so what hyperthermia does, hyperthermia actually activates dendritic cells. It actually increases the maturation of the dendritic cells, which is going to increase the presentation of these dead cancer cells to the rest of the immune system to draw them to it. It also attracts and pushes the dendritic cells into the lymph nodes. And the lymph nodes are kind of major highway intersections, if you will, on and off exit ramps of a very busy interstate that is the immune system superhighway. That's why the removal of lymph nodes can create a traffic jam in the immune system delivery and travel through the rest of the body. These are major on and off signaling pathways, and through hyperthermia, that is whole body, you're going to increase the dendritic cell activation, maturation, and presence in these major on-off rampways that are lymph nodes for the immune system signaling. And so here what you're going to see is activation of these dendritic cells, maturation and signaling and placement at key points. You're going to see the ability of this immune signaling be present throughout the rest of the body. And that brings us to the next type of immune cell, lymphocytes. Whole body hyperthermia is going to prime and activate T lymphocytes more. It's going to create a favorable balance of particular types of T lymphocytes. Effector T lymphocytes versus what are called regulator T lymphocytes. Regulator T lymphocytes do exactly what their name implies. They regulate, they counter hyperactive immune response. In cancer, you have an elevated T regulator or down suppressing immune effects. But hyperthermia raises the T effector cells, eliciting an effect against the cancer cells and decreasing that counter-regulatory mechanism. So in essence, the whole body hyperthermia, whole body-wise, systemic, not just locally, is going to raise the effect, the priming, the activation of these lymphocytes, which in many ways are kind of the Army and the Marines of your immune system, directed by things like dendritic cells. The third component is natural killer cells. These cells are awesome. These cells are like your Green Berets. They are like your specialized forces. They do exactly what their name implies. They naturally kill cancer cells, bacteria, viruses. Often in cancer, especially advanced, these special forces or natural killer cells are suppressed. But whole body hyperthermia actually increases natural killer cell activation, natural killer cell number. It's not enough to just increase natural killer cell number, but if they're all sitting around having a coffee break, what good does that do you? We want to not only increase natural killer cell activation, we want to increase their activity. We want to give them a bolt to their system and get them active and get them signaling. and get them working within the immune system to not just kill cancer cells, but to involve the direct rest of the body in that process. And these natural killer cells are directly cytotoxic to cancer cells, and they get distributed throughout the body and really concentrated in lymph nodes in areas where the tumors are. And hyperthermia, that is whole body hyperthermia, really promotes this process. So hyperthermia, whole body, will increase dendritic cell presence and activation. It will increase T lymphocyte activation and priming, and it will increase natural killer cells. All of these three components are key and prominent in a good, strong anti-cancer immune effect. But unfortunately, conventional cancer care destroys this process. And so what we want to do is counter that with something like whole body hyperthermia, or better yet, don't destroy it with maximum tolerated chemo. Actually use a low dose insulin potentiated target, but then couple it with things like hyperthermia, hyperbaric, and even other therapies. Cancer stem cells. We can really talk about the concept of cancer stem cells with hyperthermia in the same context of oxygen, because cancer stem cells are kind of that backup of cancer cells that you want no part of. We all recognize the importance of backups as it relates to our phone and data. That same concept here applies to cancer stem cells. We know they play a critical role in cancer progression, metastasis, but very important in treatment resistance and recurrence. And these cancer stem cells are very different than cancer cells that lack stem activity. These cancer stem cells often metabolically don't use sugar as much. They can make energy the same way that normal healthy cells can, but they also coexist kind of in the background of more normal oxygen environments. In the cancer or a tumor area, in the tumor microenvironment, you're going to have prominent hypoxic areas, as I've talked about, but there's also pockets of normoxic or normal oxygen environments, and cancer stem cells are going to exist in there. So what happens in hyperthermia as a treatment, whole body, you're going to push oxygen into the hypoxic areas where cancer stem cells and expand that normal oxygen environment, and that is going to really stress out cancer stem cells. So hyperthermia is itself a hyperoxygen inducing therapy. Different but similar to hyperbaric oxygen. And in so doing here with this hyper delivery of oxygen, you're countering this false multiplier of cancer that is hypoxia. And in many ways, this process is directly targeting the backup of cancer that we want no part of, what's called cancer stem cells, which again plays a key role in cancer resistance, spread, and recurrence. And last, hyperthermia augments other therapies. I mean, this is the really exciting aspect of hyperthermia, is that it's a standalone therapy to directly kill cancer cells. It's a standalone therapy to augment the immune system. It's a standalone therapy to actually target cancer stem cells and flood the tumor microenvironment with oxygen. But cancer will never be treated with a magic bullet treatment. It's about bringing the right treatments together in combination and in sequence. That's what provides precision cancer care that targets the cancer and tumor microenvironment genomically, epigenomically, transcriptomically, proteomically, metabolomically, and then immunomodulomically. We have to bring them together in sequence and in combination. Hyperthermia augments conventional immunotherapy. Hyperthermia augments chemotherapy. Hyperthermia augments radiation. And there's research showing this process to be true. Take, for example, radiation. Radiation needs oxygen to induce free oxidative, pro-oxidative metabolites to combine with copper, combine with iron to destroy cancer cells. Hyperthermia floods the zone with oxygen, and that's going to lay the platform, present the field for radiation to come in and destroy cancer cells. But more so, you combine hyperthermia, whole body here now, with integrative and holistic therapies like high-dose vitamin C, like curcumin, like mistletoe. All of these things are going to all be augmented by hyperthermia, whole body hyperthermia. So when you look at whole body hyperthermia, raising the core temperature or raising the heat, we're really looking at a historical therapy that is modern times, 5,000 years of history of hyperthermia use in the treatment of tumors and cancer. And that's what whole body hyperthermia is today. It is a mimicry of the immune system. It's tapping into the body's defenses to protect against all enemies, both foreign and domestic. And here, cancer is that domestic category. Cancer is a crisis of healing in terms of conventional treatment today. But hyperthermia allows us to focus in on healing and lose that crisis and really promote wellness and not destruction. I'm Dr. Nathan Goodyear, Medical Director here at Brio-Medical in Scottsdale, Arizona. To learn more about whole body hyperthermia or other therapies that we use as a part of a treatment strategy that includes precision cancer care, go to our website at www.brio-medical.com.